I'm Kelly Mayer, licensed clinical social worker, and today we're talking about obsessive-compulsive disorder. So, OCD affects a little over 1% of the population in the US, and there's a lot of misconceptions about OCD where people have seen in movies or in the media that, OCD is basically just washing your hands a lot. Well, unfortunately, that's really not true. OCD is actually, it's a very severe mental illness that really makes life very difficult for people with OCD. And it is not just about hand washing. There are a lot of other parts and a lot of other symptoms to OCD. So OCD is characterized by the individual having an obsession, which could be one obsession or maybe a few, maybe two or three various obsessions. And then they are also engaging in compulsions. Compulsions are repetitive behaviors that the person engages in. They can also be mental acts. They can also be avoidance. And the person is doing this in order to neutralize or to try to make the obsession go away so that they're able to cope. But these compulsions can really cause a lot of impairment in the person's life. So going back to the obsession part of OCD. So what are some typical obsessions that somebody with OCD might have? Well, there are several different themes to OCD. Now, one of them does have to do with contamination. So somebody could be obsessed with contracting a certain illness like E. coli or salmonella or HIV or syphilis. And the person is spending about 1 hour or more per day thinking and ruminating about this obsession that they may have. They may be very fearful of germs or some type of disease. But there's a lot of other OCD themes as well. Another OCD theme for obsessions is aggressive OCD. So for aggressive obsessions, the individual is very concerned that they may cause harm to another person. And this is really out of characteristic of their personality and who they are. A lot of people with OCD are very careful, cautious people. They may be very, very nice, friendly people to others, but unfortunately they have a lot of these obsessions going on in their head that maybe loved ones don't really know about, because a lot of people with OCD try to really hide these symptoms from others. So with aggressive obsessions in OCD, the person might be obsessed with, if they run over another individual with their car, running over an animal with their car. They may be really worried that they're just gonna lose control one day and start stabbing people, or that they might kill somebody that they know. They may also be concerned or have just thoughts that they may one day commit suicide. So they're having a lot of these like intrusive thoughts, which can be unwanted images or more like a video playing out in their head of them causing harm to somebody. And so the obsession is that one day, against their will, they may just start hurting other people. And so, as you can imagine, this is very scary for individuals with OCD, and it takes a lot of time before somebody even is able to really talk about this and find help for OCD, because they may be really scared about what other people are going to think of them. Another obsession that's very common with OCD is sexual obsessions. So with sexual obsessions, the person might be very worried that they are going to molest somebody, or that they are going to engage in sex with somebody, more like against their will, because it still has that theme of, losing control and doing this. With OCD, there's definitely like to differentiate. With OCD, the person does actually not want to engage in these behaviors. So the key word is these are unwanted thoughts that the person's having. The person with OCD does not want to hurt anybody, does not want to rape anybody. These are unwanted thoughts, and the thoughts are causing a lot of distress because they go against who the person is. So with OCD, it's typically the opposite of what the person actually wants to do. And so that's a good way to differentiate it with, somebody who is obsessed, that they are worried that they are attracted to children, but they are not actually attracted to children, and they do not want to engage in any type of pedophilia. So that is kind of the big difference between OCD and then, other disorders that may occur. It is a bit tricky. So it is really good to seek professional help just to help with this assessment of what exactly is going on. And so there are a lot of other OCD themes as well. And so then moving on to compulsions, a lot of typical compulsions just involve checking. There can also be mental compulsions, which could be somebody repeating phrases over and over in their head. It could be, with checking, it could be things like checking the stove, 20 times a day, checking their phone multiple times in a row just to make sure that it's off, checking locks to make sure that doors are actually locked, going around the house and unplugging items. And so with OCD, the compulsions have to always be excessive. So that means that compared to your typical average person, that the checking is significantly more than what a typical person would do. So some examples of OCD compulsions would be if, say, the person is checking 30 times a day, say the person is spending, 1 hour per day going around the house, making sure things are unplugged. Those types of things is more like what OCD would really be. Some other OCD themes could be making sure that things are symmetrical. So rearranging things around their house to make sure that they're symmetrical, to make sure that things are, color coordinated. OCD could also affect things like repetitive counting, or there could be a certain number that things have to be done a certain number of times, maybe touching the light switch 4 times in a row. And these compulsions are done to prevent harm from occurring. So somebody with OCD may believe that their family member will die if they do not touch the light switch 4 times in a row. And with OCD, a lot of times these clients do have insight, and they do know that this really doesn't make any sense. They may realize that this is what we call magical thinking. Magical thinking it's a belief that someone with OCD has, and the person may realize that this makes absolutely no sense. Another example could be maybe someone with OCD does not want to step on a crack in the road, and they believe that if they do step on the crack, that they are going to die later that day. They may know that this doesn't really make any sense. However, their brain is telling them that there's a real fear and that this is a very dangerous situation. And so they are not willing to even take a chance stepping on this crack because they truly believe that something really difficult may happen. Now, there are also OCD obsessions about, with contamination, poisoning. So maybe they are really worried to eat at a restaurant because they think that someone may put poison in their food. So they may avoid going to restaurants. Some individuals with OCD are really afraid to take their anxiety medication because they are afraid that they could be poisoned with taking this medication. Another OCD theme could be with driving, that maybe they are really worried about hitting somebody. So they're going back and they're re-driving the route, looking to see if maybe there's a dead body in the road. They might drive over a bump, and the OCD is telling them that they just killed a person. And so even though they got to their destination, they need to go back and double check that there is not somebody in the road. So those are just a few of really common OCD themes. There's really a lot of them, and OCD really looks different for each particular person. And there could be, elements of maybe over cleaning, hand washing, getting, red, bleeding on their hands due to excessive hand washing and cleaning, that could be associated with some of these contaminations or cleanliness obsessions. But OCD doesn't necessarily have to be about cleaning. It's generally about the person is worried that they're going to cause harm to somebody even though they don't want to. And so in addition to the contamination, really more, if you think more like aggressive intrusive thoughts, sexual intrusive thoughts, there can also be religious intrusive thoughts. Maybe somebody has gone to church their entire life, but now they're having these thoughts pop into their head that, do I really believe this? And they're spending, an hour a day ruminating on these thoughts, trying to engage in mental compulsions, maybe repeating certain specific prayers over and over, maybe a specific number of times, like maybe 7 times a day. They're saying this one certain prayer in order to try to prove that they really are devout. They may also be preoccupied with things like, am I going to go to hell? Do I really believe in God? They may have negative, intrusive thoughts about engaging in different particular sins. This might happen when they're at church, and maybe now they're trying to avoid going to church because this is just, it's so difficult for them. So I hope this video does convey that OCD really covers a wide variety of topics. Typically, it does have the aspect of intrusive thoughts, causing harm, and it is an ego dystonic disorder, which means that it is the complete opposite of who the person is. And so unfortunately for a lot of individuals with OCD, they suffer in silence for many years before actually going and seeking treatment with OCD. And so I'll leave you with one other example that I learned in one of my OCD trainings. So to kind of demonstrate the magical thinking concept with OCD, and how individuals with OCD, they really believe that their thoughts are powerful, and they really believe that just because they think something, that it is actually going to come true. So if you take a minute and you stare at the ceiling, and if you think about the ceiling actually falling down right now. I'm actually looking at my ceiling right now, and I am picturing it falling down on top of me. And it looks like I'm actually still here, and the ceiling is still where it was a couple minutes ago. So that's actually a really good example of OCD magical thinking. So somebody with OCD, if they have thoughts that the ceiling is going to fall on them, they think that that is actually going to happen in real life. So they tend to kind of just give too much power to their thoughts, and they spend a lot of their time trying to control their thoughts, which we teach them in therapy. You can't control your thoughts. No matter what you do, random thoughts may just pop into your head. They may be distressing, but just because you have the thought, it doesn't mean that it is, in fact, a fact. Because as we just showed, even though I thought about the ceiling falling on me, it did not fall on me. And so the person may have thoughts about, stairs falling, and so now they're avoiding stairs, or flying through a window, and now they're avoiding any types of windows, or they have thoughts about the elevator falling down, and now they're avoiding elevators, and they're engaging in different repetitive, checking compulsions or mental compulsions. And so that's why it's so important for people who have OCD just to go ahead and reach out to therapy. So a lot of people with OCD will go to therapy, and unfortunately the therapist may not really be that familiar with OCD, since it does only affect, a little over 1% of the population. And a lot of times therapists will engage in more like talk therapy with their clients. And so when this happens, the client does not get better, because you're actually providing a space for the client to just engage in talking about their obsessions. And therapy can actually sort of become a bit like the client's compulsion of talking to the therapist about the obsession, and also engaging in reassurance seeking, which can be another form of compulsion. So it's really important if you or someone you know think you have OCD, to go ahead and find a therapist who's trained in exposure and response prevention therapy, which is known as ERP. So with ERP, we work with the clients to actually face some of their fears and to actually face some of their obsessions and to work on reducing their compulsions. Because with OCD, when the client engages in these compulsions, it just fuels that obsession. And so we have to really tackle it head on. It's fine to have a little bit of cognitive behavioral therapy in the sessions and to really challenge the obsessions and to really challenge, what do you think the likelihood is that you're actually going to kill somebody when you drive your car? And have you actually killed somebody this week? How many people have you killed in your lifetime? So we do a bit of CBT in our sessions, but mostly we use the exposure and response prevention therapy, where we are actually working with a client to cut down on engaging in these compulsions. When we reduce these compulsions, the person is able to function a lot better and the person is actually able to face their fear. So we would challenge the person just to go ahead and stop checking the road, stop driving around, going back to the beginning of our route and re-driving it to make sure that we didn't hit somebody. And so by doing that, that is actually how you reduce the person's overall anxiety and you help them to be able to function in their life. So if you enjoyed this video, feel free just to like it. You can head over to my YouTube channel and click subscribe, leave me a comment, let me know what you thought about the video, and I hope to create some more videos in the future. So I'd really love some feedback just about what types of topics you all might be interested in.